Very often our patients have more than one organ system involved, the neurologic manifestations from neuropathy, gastrointestinal manifestations, musculoskeletal and orthopedic manifestations, and thus very often we need a team of medical experts to help in not only identifying these patients and diagnosing these patients, but also managing these patients. And this is going to be unique to every health system or practice. My recommendation would be to use the strengths that you have to your advantage. We have a good working relationship with several medical subspecialties in our health system who work very well in diagnosing these patients and doing a complete evaluation and then managing them going forward. Other health systems may have a very good relationship with folks who are in the orthopedic department who may have a heightened sensitivity towards diagnosing ATTR-CM in patients who are presenting to them with bilateral carpal tunnel syndrome and carpal tunnel release. So I would urge you to assess what bridges you can build within your health system, and there's no one aspect that fits all. And I would recommend that you work within the health system and work within the strengths of the health system and use that to the advantage of your patients.
Indication and important safety information. Indication. Attruby acoramidis is indicated for the treatment of the cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.